Tulane Medical School faculty in OBGYN has been pioneers and educators in OBGYN for over 100 years now. We have our 3 hospitals in the New Orleans area. They are Tulane Lakeside Hospital, University Medical Centers, and West Jeff Medical Centers. And then we also have another hospital in Central Louisiana, which is Rapid Medical Centers. So we have quite a large patient diversity in demographics. So therefore, we do have a diverse in disease and severity of the disease.
We have some of the highest rates of chronic medical conditions like hypertension, diabetes, obesity, sexually transmitted infections.
We have a very diverse group of patient populations. So diversity means the pathology. So definitely our residents are very, very well equipped after graduations in the latest techniques in GYN surgery, obstetrics emergency, as well as able to care for all of the emergency situations. The best thing about our program are the residents. They are very collegial. They excel personally and academically, and they work very well together. So that makes the environment a very healthy environment to work with.
The people are what make our residency program special. My upper level residents are unbelievably compassionate. They lead by example, and they push me to become a better physician on a daily basis.
So the residents, not the faculty, own the residency program. They involve in a yearly rotation schedule. They're in charge of their call schedule. Decision regarding medical management, big or small, are made by the resident team. So this includes schedules, operation of the clinics, operation of the surgery, the OR, how the service runs, how the team teaches students, and believe it or not, the match list.
From day one of residency, there's a really nice balance between time in the operating room, time in clinic, and time on the labor and delivery unit. One thing that really sets our program apart is our continuity clinic called Healthy Mothers. It's an opportunity for us as residents to be the primary physicians for these patients and to get to follow them for all 4 years of residency. There's a level of job satisfaction that you get from working with women in need. Really feeling like you are empowering women to make educated healthcare decisions on a daily basis.
We do have plentiful of research opportunity. We are associated with the Uptown Tulane University in the bioengineering department. We have an affiliation with the Tulane School of Public Health, so they're plentiful of clinical as well as basic science research opportunity for our residents. I'm looking for an empathetic physicians who will be trained to take care of the most vulnerable patient populations in our region. As Tulane being the 10th oldest medical school in the U.S., Tulane enjoy a renowned reputation for almost 2 centuries. So combining Tulane name's recognition with the national recognition of the Tulane residents' excellent clinical training would be a great career advancement for the graduate from our program.
It's great living in the Big Easy. There's plenty of things to do. We always have time. We have golden weekends. So you can always hang out with your friends, with your colleagues. And there's also a bunch of culinary options, so there's something for everyone.
Since the 17th century, New Orleans has been a bastion of culture and diversity, and that definitely continues today. So we believe that one of the requisites for being a great physician is being a great person. And there are few places better to develop yourself than in the Big Easy.
There are very few cities that enable a work-life balance like New Orleans does. You never feel like you're missing out on fun activities when you're working in the hospital, because there are festivals, live music, amazing food, all available in the city 24 hours a day, every day of the week. There's comfort in knowing that when you have time off from work, there will be fun things to do.
So that's who we are, and I hope that you would consider training at Tulane.